Healthcare workers are fighting this latest COVID wave with more tools than they've ever had before. That includes those antiviral pills that President Biden touted in his news conference last week.
Now we have more treatments that people can, for people to keep people out of the hospital than any other point in the pandemic, including life-saving antiviral pills. We purchased 20 million of these new Pfizer pills, more than any country in the world.
NBC News correspondent Ellison Barber joins us now in New York. Ellison, good morning. So these pills can be very effective according to this data. And as we just heard, the president says we have more of these COVID pills than any other country, tens of millions of them. But tracking them down seems to have been a problem for some people. I mean, there's not the access that there is with vaccines or tests in terms of a tool to fight this virus. So tell us what's going on and how hard they have been to find.
Hey, Savannah. Yeah, I mean, you're right. This does seem to be a very effective tool in terms of dealing with COVID-19. But the problem seems to be that the demand for these treatments, it far outweighs and exceeds the supply that is currently available. We've spoken to people who say as they've gone to speak to doctors or even pharmacists, they've had some of those people say they, one, don't know where they could find them, and two, sometimes they don't know exactly what they are. Now, why all of this is such a struggle at this point is a little harder to explain, and it's a bit of a multi-layered issue here. These treatments, they are approved under emergency use authorizations. And what we've been told by representatives from the two companies that produce these treatments, Pfizer and Merck, is that they produce them, they distribute them, give them to the U.S. government. But then in terms of how they're divided, divvied up between states, who gets priority, and communication as to where they are located, what specific pharmacies have them, all of that, they say, is something that is under the federal government's jurisdiction, if you will. Let me explain to you, or break down for you rather, some of the numbers in terms of how many COVID pill treatments are out there right now. Pfizer says 250,000 treatment courses will be delivered to the U.S. government by the end of the month. 10 million treatment courses, they say, are expected to ship to the U.S. government by June. Merck, the other company that produces these types of pills, they say 2 million of their treatment courses have shipped to the U.S. government so far, and 3.1 million courses are expected to ship to the U.S. government by the end of this month. Doctors we've spoken to, they are optimistic when it comes to these pills, but they are urging patients, saying that it takes time to produce this sort of thing in general, that it's out, they say, quicker than expected. And one thing doctors we spoke to kept saying is, remember, 2 years ago, there were not any outpatient treatment options for their COVID patients. Here's more.
Production has been ramped up, and I think there'll be more supply, and I think the government is trying to ensure that there's enough supply. But I think these drugs are not easy to produce. It's going to take some time. The good news is that we have them. The good news is that Omicron, the mutations in Omicron don't impact those drugs. Those drugs are still effective. The bad news is we simply don't have enough of those drugs.
And let's talk eligibility in terms of these pills. For Merck, the minimum age is 18 years. You need to initiate that treatment course within 5 days of symptoms. They say their treatment is not recommended during pregnancy. For Pfizer, Paxlovid treatment, which had higher rates of efficacy in some of the early studies, it has more restrictions. The minimum age is 12, and you have to be at least 88 pounds, initiated within 5 days of symptoms. But they have a very long list of interactions, potential interactions of other medications people might be taking that limits eligibility there. But the big thing, Savannah, for both of these, you have to have a prescription from a doctor.
Well, it's interesting even to hear some of the details there, because as these are just kind of starting to become accessible, we haven't heard a lot about exactly how these work, how many pills you're taking. So that's interesting to hear. What have people who have been trying to track down these pills, who either have a family member experiencing it, maybe they're sick themselves, what have they been telling you about trying to get them?
Yeah, we talked to one family, a son whose mother lives in the Houston area. She is triple vaxxed but immunocompromised. And when she contracted COVID-19, he'd heard about these new COVID pills. And he told her, hey, you need to talk to your doctor and see if you can get these. But she says when she went and spoke to her doctor, he said, if you can find them somewhere, I'll write you a prescription. But I can't do that legwork for you, and I don't know any pharmacies that have that. Her son then went on an hours-long search to try and find them. Listen.
I ended up calling 12 pharmacies and getting all different kinds of answers about whether or not the pill was available, whether or not they could tell me if they had it. Many had not heard of it at all, or are unfamiliar with any antiviral. For it to be as effective as it can be, it needs to be taken within the first 5 days of symptoms, and those days were running out, waiting on clearance and prescription and information.
So there is a website the health department has where you can go, and it's an interactive map to see exactly which pharmacies in your area might have some of these pills available. We'll show you what that looks like on the screen here, because it's a little challenging, quite frankly, to get to the website. The entire URL for it is too long for us to even put up on screen. I think we can post it on Twitter and our social media platforms. But if you search for the COVID-19 Therapeutics locator, you or your provider, in theory, you can access it through healthdata.gov and kind of get a real-time look at where some of these COVID pills are available. But people, they tell us, Savannah, they wish it was a little bit easier to find that and to navigate this system. Savannah.
Absolutely. You hear those stories of pharmacies not even knowing what people are talking about. It's very confusing. All right, Ellison Barber, we'll check out your Twitter for that information. Thank you so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.